Procurement notices, funding and grants opportunities, lists of potential partners, insights into market trends, databases of development professionals, webinars, latest news, and much more. Don't just be active in international development, thrive in it. Stay informed and connected. Visit developmentaid.org today and see how we can help you achieve your sustainable development goals together.
Hello everyone and welcome to Development Aid Dialogues, our new project exploring the heart of humanitarian aid to most critical topics. Today we are joined by Mr. Ibrahim El Haddad, a seasoned humanitarian professional with over 14 years of experience in the field. Ibrahim serves at the head of Information, Analysis and Communication Unit at the United Nations Office for the Coordination of Humanitarian Affairs, OCHA, in Yemen. I'm your host, Hisham Alam. Hello Ibrahim, it's a pleasure to have you on our podcast today.
Thank you, Hisham. Good morning.
Good morning. Let's begin by discussing the impact of the conflict in Yemen. Has it had any direct effect on the delivery of humanitarian aid?
The country has been split in two due to the war, with the series negative economic situation. It also means we depend on cooperation of the two parties in an active conflict with each other for access. Yemen is a big country. There is a large area we need to cover and a huge amount of people in need. This comes with a lot of challenges, logistical, coordination challenges. But in the last year, on average, we served around 8.5 million people in Yemen in 333 districts with over 200 partners. Despite all of these challenges, we are trying to deliver as much as we can, especially the lack of funding situation, the limited financial resources restrict any potential scale-up operation to meet the needs of the affected population.
What are the biggest challenges faced by the aid organizations in reaching affected populations in Yemen?
One of them is the displacement. We have 4.5 million IDPs in Yemen. They displaced from their own houses to another areas. There is complex emergencies in Yemen. We have health, education, shelter, wash, protection. Yemen, as I mentioned, is a big country, so we need to coordinate with the two authorities, the two sides of the conflict, and we need to reach the needs to the affected population.
How OCHA is addressing the displacement issue for people in Yemen?
Through the humanitarian needs overview, the main document that we are working, this document reflects all the needs in Yemen, covering all the clusters. Let me explain. In Yemen, there's 13 cluster active, started from mine action to shelter, health, food security, etc. So OCHA address those challenges by doing coordination with all the humanitarian organizations, with the authorities on the ground, with the local community to deliver the assistance to the most needed people in Yemen. And as I mentioned, 333 districts over a large area. This is another challenge. But what we are doing with the humanitarian community, around 200 active partners deliver some type of assistance for the affected population.
What kind of assistance?
It might be food, general food distribution, health consultation through the health cluster and WHO, in coordination with the line ministers in Yemen, provide shelter needs or non-food items, tents and non-food items and dignity kits for the displaced people. As OCHA, we maintain this coordination mechanism active, and we try to reach every area in Yemen.
Do you think that OCHA's capabilities are meeting the huge number that you have mentioned of displaced people in Yemen, or you need other external assistance from other NGOs?
Of course, as a coordination agency, we don't work alone. We work with our partners, with other humanitarian organizations in Yemen. For example, for displacement, we follow up with the IOM, International Organization for Migrants, with the UNFPA, because they have rapid response mechanism. We work with the local authorities, with local NGOs to check what is the numbers and the needs. We are speaking about 10 years of conflict now. So many of the people displaced for more than one time. So what we try is to reach to the absolute or to the most accurate number of IDPs and identify their vulnerabilities and profiling their situation.
Can you discuss the specific strategies and approaches used by OCHA to ensure the effective and efficient distribution of aid in Yemen's conflict zones?
Let me focus again on the humanitarian needs overview and the humanitarian response plan. Those documents inform the whole humanitarian response for the year. The H&O document discusses in detail the multiple needs of communities across Yemen. For example, health assistance, water and sanitation, food, protection, among other needs. The HRB document lays out the humanitarian community plan to respond to these needs, as well as how much funding is required to do so. Those two documents, we work together with all the humanitarian community, with local community to ensure that the needs reflected and the response for the coming year is planned. For this reason, we know how much money and how many people we will target in the next planning year through those two documents. And by this way,
So what is the estimated number you are targeting next year?
we will target around 11 million in 2024 out of 17 million people in need in Yemen.
So we have
And
a
we
lack of support for 6 million people?
it is
They are
not
not
lack
targeted?
of- yeah, it is not lack of support because those documents is brutalization documents. We need to brutalize our response. We can't say that we are able to respond to all the people in need. This is a wish list, or we hope to reach all people, but we try to be realistic and we try to plan for the most needed and target them.
So how
That-
prioritize this segment of people that are on the top priority for OCHA to deliver the aids?
We use a joint intersectorial analytical framework, global methodology used in humanitarian crisis around the world. So based on the JAF methodology, we can identify the number of people in need and the severity for the need.
According to what you have defined, there are 17 million people in need. And
Yes.
out of the 17, you targeted 11 millions. So
Yes.
the 6 million, this is what I mean. Till they are integrated within your standards, what happened to them? Who's addressing them? What kind of aids or support they are receiving?
There are 17 million people in need and the 11 is targeted. Now, how to identify or to define the 6 million? We take in our consideration the funding trends. So we are trying to identify the most brutalized or the most in need and try to target them as a priority. For example, some people have multiple needs and some of them have one need. So by this coordination mechanism, we can try to support either this person or the vulnerability group according to the available resources, according to our capacity on the ground, according to humanitarian partners. So a lot of factors, but we are trying to deliver the assistance to most of the people in need and mainly the target. So that this is a plan, Hisham. Our plan is to deliver assistance for 11 million. If we are able to deliver the assistance for more than 11 million, we will do that. But
Okay, I got the point.
do we have resources? The HRB, the Yemen HRB for 2023, 40% funded. So for 2024, as of today, 22%. So far, we received 596 million out of 2.7 billion. So we have multiple systems in place to ensure the safety of staff. We analyze the presence of the armed actors, the conflict dynamics, and of course, we take some physical measures to, for example, to secure the offices, our guest houses, and etc.
What you do or your team do to secure yourself and your team members, just to make our audience imagine how dangerous the situation is.
For example, We have curfew in Yemen, and we need to move from place to another place. We need to submit a permit and ensure that we have the approval from different parties. One of them is the DSS, which is the secretariat entity in charge of the safety and security of staff, and they take the lead on these issues. So once we move to deliver any assistance or visit any location, we reach out to DSS, and also we submit approval to ensure, because they have the security officers on the ground, so they are able to advise us if it is okay or not okay to visit that location, especially if it is within the front line or the areas that there is a clashes. So as OCHA, we try to follow all the procedures to ensure that our staff safe and we can deliver the assistance in a safely way.
What is the curfew time?
It depends. It depends from area to another area. So as I mentioned, Yemen is big country. We have main offices in Sana'a and in Aden. We have presence in different area in Ma'rib, in Ib, in Taiz, in Hudayda, in Sa'da.
But what is the average time? How long it lasts, the curfew?
8 p.m. or 9 p.m. And DSS, the United Nations Department for Security and Safety, they are responsible to review all of these measures and updates. So we follow their guidance in such matter. It is not agency by agency. It is under the UNDSS umbrella.
Collaboration is a key in complex situation. How does OCHA coordinate with other humanitarian actors such as NGOs and UN agencies to maximize the impact of aid delivery and to avoid duplication of efforts?
Let's start step by step. OCHA doesn't operate alone. So OCHA coordinates efforts to develop the HRB documents with extensive consultation with all stakeholders. So this document is not OCHA document, it is a humanitarian document which goes to the world. So for example, 2024 humanitarian response plan created based on extensive area-based consultation involving authorities, representatives of affected people, local and international organizations, and other UN agencies. So this approach ensures a brutalized plan that reflects the actual common needs, common objectives. Secondly, OCHA facilitates the cluster coordination system, where humanitarian organizations are grouped into clusters based on their area of expertise. The system allows effective coordination and avoid overlap in aid delivery. For example, last year we have around 200 active partners in Yemen, 150 local organizations, the rest either INGOs or UN. So for example, 50 organizations, they are working in health. So they coordinate among the health cluster. Another 40, they work with education. So there is education cluster. They are meeting on a monthly basis or weekly basis or bi-weekly, and they coordinate, they discuss the needs. Also, OCHA organizes the regular coordination meetings at the central level and the sub-offices level, bringing together all the relevant humanitarian actors. Those meetings enable OCHA and the humanitarian actors to discuss strategies, review progress, or identify gaps in the response, and adjust plans to ensure an effective and unified response.
How can you convince or encourage the 3/4 of the NGOs working in the field to follow or to coordinate with?
Imagine around 200 or 100 organizations, they are working without any coordination or mechanism. So most of them will support the same families or the same people. But through proper coordination, a lot of organizations will avoid overlapping in the assistance delivery. Also, they will save time and they will assess the situation and share information and experience. So how to convince them? I think all the humanitarian community agreed that coordination is a critical topic, and we need to coordinate among ourselves to cover the funding gaps and to respond to the needs globally. Now, if we are speaking about Yemen, we encourage to put all of our efforts in one place and work together, because our role is to help people. Our role is to help.
Advocacy plays a crucial role in humanitarian aid delivery. Can you share how OCHA advocates for access to humanitarian assistance in areas controlled by various parties to the conflict in Yemen?
OCHA plays an important role in access assessments, analyzing situation, identify challenges, and inform the humanitarian actors of the accessible, hard to reach, or inaccessible areas. So OCHA, based on our mandate coordination, engage directly with the authorities to discuss and resolve all issues related to the humanitarian access. For this reason, OCHA leads the humanitarian access working group.
If you have double authorities, a conflict of authorities, with which one do you coordinate?
With both.
With both?
Yeah.
Okay.
So, because our main purpose is to deliver the assistance and assess the situation on the ground, we coordinate with both. For example, in 2023 or early 2024, OCHA conducted several assessment missions to some inaccessible areas, or we call it hard to reach area, enabling aid agencies to reach areas for the first time since the conflict. So this happened after a lot of advocacy and a lot of negotiation and a lot of discussion with the concerned authorities.
Do you have examples of failures for making this advocacy?
In the humanitarian work, we don't have something failure, because once we start any work, there is a risk that we will not be able to complete that mission. But I think I don't have any example that we failed. Maybe it will take more time to achieve the result, but with negotiation and coordination, we will achieve, but it will take more time.
I love the optimistic approach. Can you share with me some examples of innovative solutions or initiatives implemented by OCHA to overcome logistical or operational challenges in delivering aid in Yemen?
I will give you an example from UNHCR and partners. They provided transitional shelters to IDPs in Elhadhad using locally environmentally sustainable materials such as wood and palm leaves. This initiative is cost effective and had the dual benefit of meeting immediate shelter needs and also offering economic empowerment to the communities that area. So we rely on the local NGOs. We ensure more localized solution and response activities. In terms of innovation, strengthen the overall response, enhance humanitarian access, because local NGOs, they are available or they are working in all Yemen. UN agencies and INGOs, they are covering some areas.
How does OCHA ensure that aid reaches the most vulnerable populations, including women, children, and also, as how you have mentioned earlier, the displaced persons, amidst the complex dynamics of the conflict?
All of our documents is sex and age disaggregated. So you will see that women, men, boys, girls, and people with disability, elderly people, all of, even if our humanitarian response plan. So OCHA coordinates with all stakeholders for comprehensive needs assessment and also mapping vulnerability, including the needs and locations of the most vulnerable population in Yemen. So through the cluster coordination mechanism, we ensure the response address the specific needs of population. Some of the projects will cover health and education or water and sanitation, but the consequences of that project will enhance the health situation, because if we fix the water, we will enhance the health, and after that it will enhance the nutrition and the food situation. So OCHA, in summary, works with all partners on integrated humanitarian programming that take into account the vulnerabilities, including all gender and age sensitive gears. Through this, and all of this information is public online, so you can see and compare what was the needs according to the HNO, and what is our target, and what is our reach as of March 2024 or April 2024, through a dynamic and public dashboard, because In our transparency, we can enhance the response. We can see where we need to target.
And you follow up yourself or your local partners?
We collect the information from all the partners working on the ground.
How can you guarantee that these information and the feedback are realistic? Maybe they are over exaggerating just to get more funds or to get a good feedback from you or to be a strong partner.
There is a monitoring mechanism in Yemen. So the cluster work closely with the partners and they have their own monitoring mechanism and they have their own meetings that they discuss the needs and the reach and the response and the plans on regular basis. So, and by this way, we enhance the accountability toward affected. So we are accountable. So we do some field visits. We review the situation, the numbers, and we look into that. On monthly basis, we have the monthly humanitarian update document, which we reflect the humanitarian situation and what is the response and what is the challenges. So this product is a monthly product and it covers all Yemen. So exaggeration, the last point, I think still we didn't reach to the target. As I mentioned that last year we reached only to 8.5 million. So the number is not exaggerated. And by the way, we have some aggregation rules to avoid duplication because we don't do summation process.
Like what?
For example, X organization reached to 100 and Y organization reached to another Y 100. Maybe the 100 and 100 is the same. So once we publish our reports, we apply some aggregation rules to avoid double counting. Okay. So if those, we call it as inter-cluster reach, that those numbers reached by different clusters and different partners on the ground.
Do you have in mind any examples of how the humanitarian situation is, and also if you can share with us some positive examples of progress that took place in the field?
Okay, let's start from the achievements and the progress. Recently, we published a document called Stories of Inspiration. And this document includes around 23 success stories from local NGOs, INGOs, and UN agencies covering different clusters. It is available online. And this document, the main idea is to reflect that despite the current situation in Yemen and the challenges in Yemen, but the humanitarian community, they are continue and willing to deliver more and more. This example is only cover success stories from 2023 plan. Education, building a new 2 classrooms in one of the schools, and after that, the students in that village, they start to receive a proper education, because before they used to have their education in the tent with the hot weather, etc. So they are not focused, but this enhanced the education mechanism for the students. And we have a lot of stories. There's a lot of good stories.
Do you have examples of how bad is the humanitarian situation? Example that reflects the situation?
I will go back to my previous point about Yemen. Yemen is a big country which there is a lot of needs, and there is a lot of challenges faced the human community to respond. For example, IDPs, migrants, refugees, health crisis, education, wash, etc. So what we are doing is we put all of our efforts to respond to this crisis. But what we ask is for more funding for Yemen. As I mentioned now, until this moment, 20% of the required fund to respond to the humanitarian needs is secured. 20% out of 2.7 billion, and we are almost in the second half of the year. So what we are calling is to call all the donors and to continue and support us to deliver the assistance to the most needed people.
The humanitarian needs are constantly evolving. What are the key priorities for humanitarian assistance in Yemen in the coming year, and how is OCHA adapting its strategies to address these evolving needs?
For the next year, we actually will start the planning for the next HNO and HRB in early July. But
What is it?
the HNO, the Humanitarian Needs Overview, and the Humanitarian Response Plan for the next year, for
Okay.
2025. But
Okay.
as OCHA, we invest more and more in localized response strategies based on consultation with various stakeholders, including the affected population, and to understand what is the specific needs of districts and communities. Last year, we did something called area-based approach. We visited almost all the governorates in Yemen with humanitarian community and with the line ministers, and we listened from the ground. We hear the needs, what is the needs, what is the situation on the ground, and we reflect this in our HRB last year. So prioritizing multi-sectorial and integrated programming to ensure the interventions to address a wide range of needs from health and nutrition, shelter, livelihood. Okay, so this multi-sectorial and integrated programming, it will enhance more and more the situation, and this is one of the priorities that we are doing. Also, utilize the cash-based assistance, provide the affected population with the flexibility to address their most pressing needs by buying something from the local market, and also to support the local economy.
It's on monthly base, the cash?
It depends on the criteria and eligibility. We have cash market working group in Yemen, and all the cash actors, they are members in this working group, and they coordinate among themselves. But this is the top picture. What we will do also to continue working closely with the authorities to add the security situation to ensure safe access and timely assistance to people in need. So
How
a
do you
lot
build trust with the authorities?
by coordination,
Only
by
coordination?
coordination, negotiation, meeting with them.
How do you convince them to cooperate with you?
I think we work in Yemen, and what we need is to ensure that we work to support the people in need, to respond to the humanitarian needs.
Part of your work is to coordinate or to deal with militias, people that have different mindsets. How can you convince them to find a common ground to negotiate mutual benefits?
OCHA led last year the area-based consultation workshop, and this covering all the governorates in Yemen. And these consultations were mainly to ensure localized response tailored to the specific needs of each community. Line ministers were there, humanitarian community were there, local community, the people from the ground, they participate in those consultations. We will continue to ensure that the voices and from the people is heard and listened, and we will continue to advocate to respond to their needs and try to support the Yemeni people. This is our role, so we will continue to do that.
I would like to ask you about technology. What is the role of data and technology in improving the delivery of aid in Yemen conflict zones? And any notable success or challenges in this regard that comes in your mind?
When we started this area-based consultation, it was based on analyzing the data. So, as I mentioned, we receive the 4W data, who does what, where, when, on monthly basis. Okay, but by analyzing this information, we look what we need to do more, what this data tells us about this IDP, for example. So what we are doing is try to analyze all the available data in Yemen and to review our response, review our plan based on the available data. In Yemen, assessments is by the end of the day is a day. So we need to analyze this assessment data or collected and try to build synergies between this data set and the other data set to see what is the full picture. So this involves a regular feedback consultation with all the stakeholders, with the communities, and to enhance our decision-making process, to see what is the feedback they will provide us on the effective of our aid intervention. So we will utilize all the available resources, either technological, community engagement, data, etc., to achieve the main outcome that we have a proper and effective response in Yemen, which respond to the people in need, and we will target the most people in need according to the available resources.
Yes.
Because as I mentioned, we have other crises in the world, so we need to ensure that Yemen is still on the map.
As an UN officer, it is expected sooner or later to move with another mission to another place. What will you keep in mind and in heart from your experience in Yemen?
I think it will struck my heart that Yemen is a beautiful country. So they deserve to have some peace. Without peace, Yemen will continue to suffer. So we called in Arab countries Al Yemen al Saeed, happy Yemen. So I hope
Yes.
one day we will see Yemen again, happy country without war, without any humanitarian crisis, and go and visit the nice places in Yemen. There is a lot of nice places. So what will stuck in my mind, to be honest with you, the people in Yemen. They are very kind people in Yemen. Their hospitality is amazing, and I hope one day after leaving Yemen, go back to Yemen and visit those places without any humanitarian crisis there.
That was a truly insightful conversation, Ibrahim. Thank you for sharing your expertise and the important work OCHA is doing in Yemen. The situation in Yemen remains incredibly complex, but thanks to dedicated professionals like yourself and your team, there is still hope for Yemen people. For our listeners, stay tuned for another enlightening conversation on Development Aid Dialogues. Until next time, this is your host, Hisham Alam, signing off. Goodbye.